Now, there's nothing worse than sitting in an emergency department wondering when you'll be treated. We know our hospital system is under extreme pressure and patients are paying a terrible price. But one doctor has decided it's time to act, opening his own walk-in emergency department and promising you'll only have to wait half an hour.
We can cut down lots of steps and get the care straight to the patient without wasting much time.
Australia's healthcare has long been among the best in the world. But emergency department wait times are now at record highs. This doctor says he has the solution.
Typical waiting time in more than 90% of our patients is less than half an hour. And the duration of stay average is around 1.5 to 2 hours.
So a key feature here is such a quick turnaround in results, isn't it?
Correct. So the clinic has been modelled around to see acute patients, so that doesn't make any sense to delay the results by 24 hours or something. So our radiology department, if you see here, is active whole 12 hours, and the results are being delivered within an hour of a CT scan or an X-ray.
Dr Pankaj Arora's founder and CEO of WISE, the walk-in specialist emergency clinic. He's been an emergency physician for 28 years. 5 years ago, Dr Arora opened this private emergency room in Macquarie Park in northern Sydney.
Majority of our patients who come to us are injuries, which accounts to 40% of our presentations. And the next big one, surprisingly, is abdominal pain, chest pain, headaches, dizziness, urinary tract infections, pneumonias, and cough, cold and flu as well at the bottom of the list.
There seems to be a bit of a problem with my back that's running down my hips and the outside of the right leg.
Glenn's in a serious condition. He's been seen by WISE doctors and will shortly have scans.
I considered going to emergency, but I had an appointment with the GP this morning and I pretty much planned on going straight from there to here. So I was hoping it wasn't serious enough to call the ambulance.
There are around 9 million presentations to emergency departments every year. Dr Arora tells us 6.2 million patients are not admitted to hospital. He designed WISE to look after those patients.
Good little trooper, but we just want to make sure we're fighting the right fight.
Little William isn't well.
We actually waited nearly 3 hours at another venue for emergency care just to be told that we should just go home, give Panadol. We also had a follow-up call saying we probably should go straight to RPA for an emergency X-ray on his chest. But anyway, we've come here because we've heard good things, so the best available care in the area, and there's no wait time.
Our presentations are 25 to 30% are of children less than 16 years of age.
I guess it can be a little bit less intimidating for a child to come to a place like this as opposed to a big hospital.
Absolutely. Some of the parents even say this is a healing area. They were sick there, but they're not sick here anymore.
There's a catch. Being a private facility, patients have to fork out $260 a visit. Additional costs for blood test and radiology is paid by Medicare, up to about $500. The average cost to the government to see a non-admitted patient in a public emergency department is approximately $700.
The cost of providing emergency medical care is really, really high. So absolutely there's a place for looking at our reform of our private health insurance industry and whether or not they are in a position to cover emergency department care.
Dr Sarah Whitelaw is the Australian Medical Association's emergency medicine representative. She says private clinics are an important part of the emergency system, but more work needs to be done.
The best way to fix our public hospital crisis is to fix our public hospital crisis. But my goodness, if we don't work on keeping the staff that we've got in the system, then we are going to be in a much bigger trouble over the next few months.
This is the latest ad from the New South Wales government, reminding patients that emergency rooms are for emergencies only.
If it's not urgent, contact your doctor.
We had a system that was so close to the edge and running at over capacity before COVID that the pandemic and the staff shortages have meant that our system has suddenly gone into crisis.
This month, a WISE clinic will open on the Gold Coast. Dr Arora believes we need 50 across the country.
If you do not need an ambulance or you are not feeling that sick, but you still need to attend someone in emergency because you feel that there's an emergency for you, we can treat any condition.
And of course, if you believe you have a life-threatening condition, always ring 000 and get an ambulance.